Confirmation of the existence of the Brazilian P.1 variant was made recently by Paho's advisor on emerging viral diseases, Dr. Jairo Mendes Rico, during a virtual presentation. Dr. Mendes Rico said that 37 countries in the Latin America and Caribbean region, including Guyana, have confirmed the presence of one or more variants of concern. However, when asked about the pronouncement made by Paho, Minister of Health Dr. Frank Anthony claimed that he is oblivious of the presence of the variant in the country. He made these claims during his daily COVID-19 update on Tuesday.
This is really news to us. I have since asked Paho for a report pertaining to this disclosure, and we are awaiting Paho's response.
Despite the significant threat posed by the P1 variant as a result of Guyana's proximity to Brazil and the porous borders that connect the two countries, local health authorities seem to still be pussyfooting with sending patient samples abroad to undergo genome sequencing and determine the presence of the new variant.
We continue to try to work with agencies that can get this done for us, but so far we have not succeeded in getting samples to these agencies.
Two of the agencies referred to by the minister are the Caribbean Public Health Agency in Trinidad and Tobago, which has offered to test patient samples from Guyana free of cost, and the Icahn School of Medicine in New York. Following the revelation by a private laboratory of suspected variants in the country, 10 patient samples were sent to CARFA for testing in January. A week later, Dr. Anthony disclosed that the results from the samples did not indicate other variations of the virus. Prior to Dr. Mendes Rico's announcement, Director of the Pan American Health Organization, Dr. Carissa Etienne, in April had highlighted that the spike in new cases and deaths in Guyana and other territories was a result of a new variant. However, the Health Ministry, via a press release in early April, had admitted that Guyana has been hit with a new strain of COVID-19 that is stronger, deadlier, and faster spreading. According to the ministry, the new strain is so severe that it attacks healthy young adults with no pre-existing conditions and no comorbidities. Despite a number of neighboring countries recording mutant strains of the virus and a drastic sudden upsurge in new infections and deaths in the last few months in Guyana, local health authorities have not adjusted the curfew or any of the gazetted measures. No travel restrictions have been instituted for visitors from the affected countries, and repeated calls from numerous sections of society for a more prudent response from government seem to have fallen on deaf ears. However, the Brazil to Guyana air and land borders remain closed, with exceptions for bartering on Thursdays. Neighboring Trinidad, which recently confirmed the presence of the P1 strain, is also fighting to manage the sudden drastic uptick in new infections and deaths. However, the island recently declared a state of emergency and has reverted to a 9 p.m. to 9 a.m. curfew. Meanwhile, Guyana's main response to the situation, its aggressive vaccination program, is forging ahead at breakneck speed. The ministry reported that the largest number of persons were vaccinated on Monday since the start of the program. According to the health minister, close to 7,000 persons received the first doses of the vaccines on Monday. Overall, 34% or 169,981 persons have been partially immunized, while 34,317 have been administered both doses of the vaccines. The target is to achieve herd immunity to the disease, which would necessitate 80% of the local adult population, the equivalent of 500,000 persons being vaccinated. In trying to seek a comment from Guyana's Paho WHO country representative, Dr. Louis Cadena, Nightly News was informed that he does not conduct individual interviews, and such interactions will have to be conducted in collaboration with the Ministry of Health. Temika Rodney reporting for the HGP Nightly News.